Understanding more about the nexus between global pandemic and mental health, we'll now dive into understanding the response of people to preventive measures like social distancing, lockdown, isolation, and quarantine. While everyone is staying home, kids and adults might start to become bored and frustrated by doing the same things again and again every day. Boredom is not a very happy or nice state to be in. It's aversive. Individuals are unable to engage in a satisfying activity. Quarantine and isolation have led people to engage in media use to relieve boredom, like binge watching, etc., which also sometimes might result into negative psychological experiences. Other behaviors may include having a lot of mood swings, losing control over feelings, lashing out over small matters, feeling on the edge of most of the times, staying irritable and frustrated, and finding blames constantly. Feelings of anger in verbal or physical form may also increase during this time. Getting angry over small matters, not being able to control it, and getting into verbal or physical fights frequently may increase during this time as a result of the frustration rising among youth. Lack of freedom, job difficulties, personal life matters, and the inconveniences faced during this time are contributing factors to it. It has also been noticed that feelings of loneliness have risen with people staying aloof and isolated. Not being able to meet and greet loved ones has had a detrimental effect on people's mental health. Having a social life and social routine is a distraction and escape from the monotony of life, and we humans are social animals. Being compelled to reduce social interaction has affected many and has led to excessive distress. Now, to understand how these preventive measures and COVID-19 has led to the rise of stigmatization of the disease in people. As we have all heard news of health professionals, frontline workers being evicted from their homes by anxious landlords. And the attitude of general public towards those who have been tested positive for the virus is not too great. Social stigma in the context of health is the negative association between a person or group of people who share a certain characteristics and a specific disease. In this particular outbreak of the pandemic, this may mean that people are being labeled, mislabeled, stereotyped, discriminated against, treated separately, and are experiencing loss of status because of a perceived link to the COVID-19 disease. Such treatment can negatively affect those with the disease, as well as their caregivers, family, friends, and communities. People who don't have the disease but share only characteristics with this group may also suffer from stigma. The current COVID-19 outbreak has provoked social stigma and discriminatory behaviors against people of certain ethnic backgrounds, as well as anyone perceived to have been in contact with the virus. The level of stigma associated with COVID-19 is based on three main factors. These are the causes of stigma, which is first can be it's a disease that's new, for which there is still a lot of misinformation. Not everything is known about this disease. A lot of things are unknown. So people tend to make up stories and create a version of what might happen if a person gets this disease. And lack of information can cause stigma. Then we are often afraid of the unknown because a lot of things about this disease is unknown. Person is scared. They fear the disease so much. Then it is easy to associate that fear with others. One does not want to internalize that fear. One is scared of the fear. So they try to put it on others as a defense mechanism. And it's easier. Now, to combat this stigmatization, certain do's and don'ts have to be followed to reduce it. One needs to appreciate and acknowledge efforts of the professionals providing essential services and be supportive towards them and their families in this tough time. These are healthcare professionals, law enforcement professionals, sanitization workers, etc. It is very essential to make sure to share only the authentic information regarding COVID-19 through the website of Ministry of Health and Family Welfare, Government of India, World Health Organization, CDC, etc., and not any other platform. Before forwarding information related to the virus through messages or social media platform, it's very important to make sure to cross-check and verify that information. Another thing of great importance is to share positive and uplifting stories of those who have recovered from COVID-19 and to not disclose names or identity of those affected or under quarantine or their location on the social media. Make sure to avoid spreading rumors that create fear and panic among people. Do not target healthcare and sanitary workers or police for the spread of the virus. And do not label any community or area for the spread of COVID-19. Also essential to not address those under treatment as victims, as COVID-19 victims. Some other terms that one can use are people recovering from COVID-19, COVID survivors, or even COVID warriors. Ethical journalism in terms of circulation of not fear-based but correct factual information can also curb the spread of stigma. It can be done by not targeting particular ethnic groups on the news channels and amplifying positive stories of recovery from COVID-19 and experiences of people who have recovered from the virus, and treating frontline workers as heroes would play a great role in reducing stigma. In this lecture, we studied about the different psychological, behavioral, and emotional reaction impact of pandemic and preventive measures. The psychological reactions to the imposed precautionary measures, and emergence of stigma with COVID-19, its detrimental effect on human mind, and the do's and don'ts that can be practiced by all to curb this stigmatization and promotion of positive mental health.